everybody. I'm Marla with 9 Health, and we wanted to come to you today with our Health Happens, which we do every Tuesday live. And we, on the first Tuesday, are going to be talking about the topic of the month. And so this month is Colorectal Awareness Month. And so we're lucky to be here at Swedish Medical Center, and we have you are a gastrointestinal doctor, so you
Yes.
know all the things about not only colonoscopies that we're going to talk about in colorectal cancer, but other things we were just talking about too. So
Yes.
there's a lot of things that could kind of ail you in your GI system, which is what, your intestines, your stomach, what does it all entail?
Right, so the gastrointestinal system is everywhere from the esophagus down to the
Okay.
colon.
Okay.
Includes the liver, the pancreas, the bile ducts, so it's a wide range of organs that we deal with.
Okay, good. And it's so important to us because that's how we kind of digest food, and that's how we get our nutrients, and so it's active for us every day.
Yeah, we're actually learning a lot more about the role of the gastrointestinal tract, both for nutrition, digestion of food, and also what we were just talking about before, the role of the bacteria in the gut, which are probably important for a large variety of other diseases as well.
Yep. So we're going to get into it a little bit. We want to focus a little bit on colorectal cancer because that is the awareness month it is. But also, before we kind of dive in, I want to remind you that we're here every Tuesday. Last week we were talking a little bit about the heart health and why that's important. So we had some tips for you, and I didn't know that kids should start getting checked for their cholesterol at 10 years old. So if you have questions or if you missed that, go ahead and check it out on Facebook, or you can go to 9healthfair.org and you can check out the video. So that's super surprising to me about cholesterol. So I'm sure we're going to find out some things today here with you too that maybe we didn't know before. So that's the beauty of it. And if you have questions, you can go ahead and ask us the questions. We'll try our best to give you a great answer. Let's go ahead and dive in. You said it's all the way from the esophagus all the way down to the intestines, and I think for we kind of focus a lot on colorectal cancer because it's preventable.
Right.
But tell us what's like the most treatable. Like, what do you see the most when we're in an exam room here? So, what do you see the most in here?
Yeah, well, it's a hard question to answer because we see a wide range of symptoms and diseases. Everything from acid reflux, irritable bowel syndrome, ulcerative colitis, Crohn's disease, pancreatic cancer. Probably the most common statistically would be irritable bowel syndrome.
Okay.
So that we do treat that frequently, but as I said, there's a wide range of diseases and symptoms that we treat as gastroenterologists.
Well, that's kind of a good lead-in because maybe colorectal cancer has some symptoms that could be confused with other things, but what are the symptoms that we should be looking for when we're talking about colorectal cancer?
So the main symptoms that we look for are blood in the stool, anemia, changes in bowel habits, changes in weight. All of those things can be symptoms of colon cancer. But the other thing that's important to know is that sometimes there are no symptoms, which is why all patients should be screened for colon cancer. Average risk patients should be screened starting at age 50, but African Americans starting at age 45, and patients with a family history of colon cancer or certain diseases should potentially be screened even earlier.
Okay. And how would you know if you had a family history? Would you just ask your family, or how would...
Yeah, typically it's just asking the family, and the most important risk factors would be family history in a sibling or a parent, although second-degree relatives like grandparents does increase the risk as well, just not as much.
Okay.
Yeah.
And you're saying the colonoscopy really is the gold standard. You'd want to kind of do that one if you have any risk.
Right, yeah, colonoscopy is the gold standard. It is better than the other tests that we have currently at detecting really small lesions. And the nice thing about colonoscopy is that when we find the polyps, which are the precancerous lesions, we can remove them right then at that time.
Okay.
With some of the other tests, if it comes back positive, then you need to have a colonoscopy afterwards.
Okay.
But the bottom line is the best test is the one that actually gets done.
Right. Well, and we were talking a little bit about this before. So at Nine Health Fair, we actually offer a colon cancer screening kit, which is called the Ensure Fit Kit. And so if you go to any Nine Health Fair, you can purchase one of these for $30. You take it home in the privacy of your own home, and it sounds like it's going to be hard to do, but really it takes just a stool sample, right? And
Right.
you literally don't have to touch anything. This is a long stick, right? And you just stick it in the bowl after you've had a bowel movement, and you just swish it around, and then you would put it here, right? And then you could throw it away. There's a bag and everything. Throw it away. And then you do that again for a different bowel movement, do that again, and then you just mail it in. And so by doing that, like you said, right, it's something.
Right.
It's
exactly.
not a colonoscopy
Yeah.
for sure,
Right.
but you would get, what would that tell you if you sent that testing?
Well, it comes back either positive or negative, and it really is looking for either colon cancers or more advanced precancerous lesions. So if the test comes back positive, then it definitely needs to be followed with
Right.
a colonoscopy.
Right.
Yeah.
And we've heard a lot of stories and some statistics that show that younger people are having a higher incidence of colorectal cancer
Yeah.
that may not be getting the colonoscopy, say, in their 20s and 30s.
Right.
So would this test be, at least something that they could do before it's time for a colonoscopy?
Yeah, I still think if somebody is having symptoms like blood in the stool, changes in the bowel habits, a colonoscopy is still a good
Yeah.
first test. As I said, this test is still better than nothing, but I think the most important thing for even young patients, even in their 20s or 30s, if they're having symptoms like blood in the stool, anemia, changes in bowel habits, to not just ignore it or attribute it to things like hemorrhoids, that they should be seen by their doctor and evaluated for a colon cancer screening test.
Yeah, really good advice.
Yeah.
I mean, don't ignore those symptoms.
Exactly.
You don't know what they might be.
Right.
So, but if you may not have symptoms, then it might not be a bad idea just as a routine check, right?
Right. Yeah, and actually the American Cancer Society is now advising that we start screening at age 45.
Yeah.
So it is because we are seeing, as you said, younger and younger patients with colon cancer.
Yeah. So I think people sometimes are a little worried about a colonoscopy.
Sure.
They think,
Yeah.
oh my gosh, that sounds really bad.
Right.
So I, for one, have done it, and I lived. Okay.
You're here today.
I'm
Yeah.
here today.
Yeah.
So what would people want to know? What's the questions they ask you that, like,
Yeah.
I don't want to do it, it sounds like, what are they saying?
Sir, I think everybody's fear is that it's going to be really uncomfortable, and I can tell you, I think the most common reaction I get afterwards is, wow, that really wasn't bad.
Yeah.
The prep is definitely the hard part. It is important.
Agree.
It is important to help clear you out, so that when we do the exam, we can get a really good look and find those really small precancerous lesions and remove them.
Yeah. But when you say prep,
Yeah.
what you really mean is there's like some liquid to drink.
Yeah.
And it depends, who's doing your colonoscopy, but there's always some liquid to drink. And
There's definitely some liquid to drink. Yeah.
and then once you drink that liquid, there's stuff in it that makes you go to the bathroom, eliminate,
Right.
and clean out your colon.
Right.
So,
Yeah.
and that I think is what people are a little bit worried about. I know I was like,
Yeah.
oh my gosh, after you drink that stuff, like, stay home.
Right.
For like hours, you have to stay home because
Yeah.
stuff starts coming out.
Yeah, you definitely
Yeah.
want to take that whole day off, but it is the volume of the liquid that you have to drink has gotten smaller.
It's gotten better.
And most recently, it used to be a gallon. Now it's less. So the vast majority of patients get through it without difficulty, and we give you different kind of tips and tricks to get through it.
Mm-hmm.
But once you've done that part and done the bowel prep, then really the patient's job is done. By the time you get here, we put an IV in your arm. We give you some relaxing medicines to help get through the procedure. But it's really not a painful procedure at all.
No, I would agree.
Yeah.
I did it. I didn't even know anything happened when I woke up.
Yeah, and that's exactly what we hear every day, is that it's not that bad. It only takes about half an hour. It's a very safe procedure.
Yeah.
So I think it is
Yeah.
it is important to dispel some of the myths out
Right.
there.
Right. It's not that bad.
Yeah. It's not that bad. Yeah.
And I hear the prep is getting even better and better every year, so pretty soon it won't be
Yeah.
a problem.
Yeah, maybe we'll even have one that's pill based in the near future. We'll see. Yeah.
Okay. Okay. And the reason we're talking about this colonoscopy is because colon cancer is really very curable, very treatable,
Yeah.
right? So, but meanwhile, it's still the second leading killer among cancers.
It is.
That's so paradoxical to me.
Yeah. Yeah, it's unfortunately it's a very common cancer, but the great thing is we do have with these screening tests we can actually reduce the incidence of colon cancer by 90%. So when found early, it is very treatable. It has a very good survival rate, and again, the goal with these tests is not even necessarily to detect colon cancer, but to detect the precancerous lesions and treat those before it ever even becomes colon cancer.
Yeah, talk about that a little bit, because when you have a colonoscopy, if
Mhm.
there is something in there, it's a polyp, right?
Right.
You could take that right out.
Yes. Yeah. Colon cancer is generally very slow growing, and it goes from a progression of small polyps to big polyps to colon cancers. So we'd like to find these when they're really small, and we remove them at the time of the colonoscopy.
And you don't even feel that.
No, you don't have those types of pain receptors in your colon, so removing the polyps is completely painless.
And then if you remove those polyps, you basically remove the possibility of the cancer growing.
That's correct.
Yeah. So that's important. I
Yeah.
think one of the reasons why, and correct me if I'm wrong, that people die of cancer is the second leading killer is because they don't catch it in time.
Right, absolutely, yeah. Precancerous colon polyps are benign, so if removed before they turn into colon cancer, then yeah, there's no chance of developing cancer. If you do have polyps, we do bring you back for your next colonoscopy a little bit sooner, because if you've had polyps in the past, you're at risk of forming more
Okay.
down the road.
What do you mean sooner?
Well, it depends on the number of polyps. If it's just 1 or 2, then it's typically 5 years. If it's more polyps, then it can be 3 years.
Okay.
And that also depends on other factors like family history. So some patients do get screened a little bit more regularly, but if colonoscopy is totally normal and you have no other risk factors, then you only need one every 10 years.
10 years, that's great.
Yeah, yeah.
Yeah, that was me. I was clear, so I don't have to do it for another 10 years.
Yeah.
Woo!
Yeah.
So really good. So tell us a little bit more, why you felt it was so important to talk about in this month, March, about colon cancer.
Yeah, I think I think everybody knows what a colonoscopy is, or most patients do, but there's a lot of fears about it out there.
Right.
So I hope we can kind of dispel some of those fears and encourage everybody to get screened, either with a colonoscopy or with another test. But currently, 1 out of 3 Americans is not being screened in any way for colon cancer.
Yeah.
So it
That's
is
a
really
big
important.
statistic.
Yeah, absolutely. So it is really important, given that it is a disease that is so easily treatable if caught in the early stages or even before it turns into colon cancer, that we get the word out and get more people screened.
That's right. So that's our big message today.
Yeah.
Is people should get screened for colorectal cancer. The colonoscopy isn't that bad.
No.
We've lived through it. And if nothing else, do a different test. One of these tests is, what did you tell me about this test? It's the best test is the
best test is the one that actually gets done.
That's right.
Yeah,
That's right. So if you're going to do it, if this seems easier to you, at least it's something.
Right. Absolutely.
But I think as we get to be 50 years old, I think probably we should encourage everybody to have that colonoscopy.
Yes, absolutely.
Now, is this covered by insurance? So people may be worried about cost.
It is, yeah. It is completely covered by insurance, so that should not be a factor at all. All major insurances, Medicare, Medicaid, cover screening colonoscopies now.
Yeah, it's a thing when everyone's covering it, right? They really want you.
Right.
They really want you to do it.
Yes.
Yeah. So cost shouldn't be a consideration. The discomfort shouldn't really hold people back.
No.
So I don't know. What else could we tell people that would encourage them to get screened?
Well, just that there aren't a lot of cancer screening tests out there that can treat those precancerous lesions at the same time. I think that's kind of unique to colonoscopy, which is part of the reason why I decided to become a gastroenterologist. I think it's It's an incredibly powerful test, and one that nobody should be afraid of.
Great. We're going to end there. That's great.
Great.
Thank you so much for
You're
taking
welcome.
time
Yeah.
and sharing this with us. I think it's important to know. So we're going to go ahead and sign off here, but thank you for watching, and we'll be back next Tuesday. We have another important topic to talk to you about, and if you still have questions, you didn't get your questions answered, go ahead and type them in the feed. We're going to type some resources in there for you, and we can do some research and help you out with those answers. So thanks very much, and we'll see you next time.